Let's talk tox. And by tox, I mean neurotoxin. Brands you might be familiar with: Botox, Dysport, Xeomin, Jeuveau, Daxxify, Latebo. So those are all the ones that are on the market right now. Neurotoxin is strictly going to affect the muscles. It is not adding in volume. It is not creating collagen. It is strictly affecting your muscles by weakening them. It is botulinum toxin, essentially. So we use small amounts to help modulate how our muscles work. As we get older, it's not that our muscles get stronger, and that's why we need Botox, because all Botox is doing, or neurotoxin, let's just say neurotoxin, all tox is doing is paralyzing or weakening the muscle. So why do we do neuromodulators or tox as we get older? It's because our skin is thinning out. So when we're young, our dermis, our skin is thicker. We have more collagen, we have more elastin. So our skin does not fold as easy. As we get older, our skin starts to thin out. So when we use our muscles and we're contracting them, we see our skin start to fold over. So if you don't keep your skin in good shape starting in your 20s, you will need neurotoxin sooner. You might need it more often or in larger quantities. So keeping your skin in good shape is going to help if you really want to try to avoid doing neurotoxin or doing it as often. You can do this by things like microneedling, lasers, good skincare, quarterly facials. All those things are important. But back to neurotoxin. So all it's doing is paralyzing the muscle. So when we raise our eyebrows up, it causes these little horizontal lines in our forehead. So when we sprinkle a little bit of neurotoxin in here, it helps smooth that out because we're not going to contract as much. Now we have to be very careful in this area because it is an elevator muscle. This frontalis muscle helps hold our eyebrows up. So if we do too much toxin here, or if we place it too far down, we can drop the brows and make them heavy. Another area that we do neurotoxin very commonly is the glabella area, or the Levin lines. These are our corrugator and procerus muscles that pull in and down. So these are depressor muscles. So when we put neurotoxin into these muscles, it can help open up our eyes and prevent the Levin lines from forming. Another common area: crow's feet. The muscle around our eyes, the orbicularis oculi muscle. It's a sphincter muscle, round muscle around our eyes. It contracts in and down. So this muscle can pull, if we squeeze our eyes tight, it can pull the lateral corner of our eyebrow down. So if we put a little neurotoxin right in here, it's going to prevent the pull down, and it can help give us a brow lift. This is what we refer to as a liquid brow lift. If you want maximum lift, don't do any neurotoxin in your forehead area, because this is the muscle that's going to lift your eyebrow up. So now this muscle is going unopposed, because this muscle won't be working. If we tox this muscle, it won't pull down as much. So the frontalis muscle will go unopposed and really help pick up the brow even further. As we travel around the crow's feet area, this is when we start getting lines down here. We can continue the neurotoxin placement down here, and then some people even under the eye in the jelly roll area. You have to be careful in this area. If you are prone to swelling under your eyes, allergies, anything like that, please let your injector know, because this is where you can get in trouble. One of the functions of our orbicularis oculi muscle around our eye is to help pump lymph fluid out of the area. This is a very delicate lymphatic system under our eyes. We don't have any valves in these lymphatic tracts, so it's very easy for fluid to accumulate. So if you do too much neurotoxin around the eyes and you're already prone to puffiness, like I am, even the smallest amount placed under here can cause your puffiness to get worse, or you can get this dead eye look or a shelf if you have very strong cheeks. So you got to be careful in this area. Lip flip. I get this question all the time. So a lip flip is not adding volume into your lip. It is using neurotoxin, which once again does not add volume. It does not create collagen. You are simply putting botulinum toxin in your lip. So let's talk about what this muscle does, our orbicularis oris muscle. So this muscle purses. Okay, so that can cause the vertical lines around our lips, straw lines, smoker lines as they're referred to, or it can flip our lip under. So when we smile, our lips go away. So if you are one of those people that just tend to purse your lips a lot when you talk, you may have never been a smoker in your life. Doing a lip flip can help smooth those out, because you won't be able to purse your lips as much. That's why it can be difficult to drink out of a straw afterward, or feel funny to say B's or P's, because you tend to purse your lips when you have to pronunciate or enunciate those letters. So that can help with the smoker's lines. And at rest, doing a lip flip like this, you will not notice any difference in the volume of your lips. So if you're wanting more volume at rest, you need to look for filler. hyaluronic acid filler. You're not going to get the same results from a lip with neurotoxin. Now, what it can help with is when you smile, if your lips go away, it will help with that. You will show more pink to your lip whenever you smile. And for some people, that makes all the difference in the world. Now, some people, it's not just their lip disappears when they smile, but they may also have a more gummy smile. This muscle that runs from here to our lips really pulls up. So when we put a little neurotoxin right in here, it can help prevent a gummy smile, prevent our lips from pulling up. We can also help TMJ, or if you have hypertrophic masseters, these are muscles that help us chew. If you have very strong masseters, TMJ, clenching, grinding issues, neurotoxin in these muscles can really help. Some people pull down a lot when they talk. Your DAO muscles that can help kind of curve the smile up, prevent that frown from going upside down. And then some people, when they talk, they get that put the orange or that orange peel type looking of chin. Like that. So this mentalis muscle, it causes our our lip to go up and pout out. So when we put a little neurotoxin in this muscle, it can help prevent that mental crease right here from getting deeper on people, and can help smooth out the chin if you have that kind of orange peel type texture whenever you talk, if you're very strong in the mentalis area. These are more of the common areas that we use neurotoxin. Of course, neck bands is another option. If people get too jowly, we can place a little strategically along the jawline. This is not going to help with jowls for everybody. If you pull down a lot when you talk, if your platysmal bands overlap your jawline in a very strong way, those are the people who are going to see the most impact when we're doing neurotoxin injections around the jawline. I have some people come in, they see TikToks and Instagrams, reels and things like that. Like, oh, I saw that if we place Botox here, it's going to help with my jowls. But if your jowling here is just due to skin laxity, neurotoxin is not going to help with that. It doesn't magically tighten your skin. It's just going to help prevent the muscles, which sometimes people are very strong with, and they pull down. It's just going to help relax them. So for the right candidate, it can make a difference in the jowls, but sometimes it's a waste of money. So you have to be assessed by your injector to see if it will make a difference for you. So neck bands, jowling, Barbie Botox, that was big for a while. So in the trap muscles, that can help. There's so many different uses for it. So huge neuromodulator. Tox fan over here. I carry 3 specific ones here in my office: Dysport, Daxi, and Botox. Those are my favorite. I have been injecting for 13 years, and when I first started, there was only Botox and Dysport. So I've used all of them in myself and on patients, and those are the ones that I'm most happy with and my patients are most happy with. If you have any questions, or if you want me to dive in anything further, please comment below, DM us, or call.